Have you ever popped a pill for a simple headache, or maybe relied on medication for better sleep or allergy relief without giving it a second thought? Most of us don't realize this, but some of the most common and safe drugs sitting right in our medicine cabinet can quietly damage one of the most important organs in our body, the liver. Your liver is like the body's built-in detox machine. Every sip of soda, bite of food, or pill you take has to be processed by this powerful organ. But when you overload it with certain medications, especially in high doses or for long periods, you're putting your liver at serious risk. In this video, we'll look at 5 of the most popular drugs that can cause liver damage if overused. Stick around till the end, because the last one might surprise you. It's something millions take every night without even thinking twice. Let's start with acetaminophen, also known as paracetamol or Tylenol. This is one of the most widely used painkillers in the world. Headaches, fevers, muscle aches, this is the go-to pill for many people. But here's the catch. While acetaminophen works wonders at relieving pain and fever, it's also the leading cause of acute liver failure in the United States. Why? Because the safe limit is surprisingly easy to cross. Doctors recommend no more than 4,000 milligrams a day for adults. That's usually 8 extra-strength tablets. But here's where people get into trouble. Acetaminophen is also found in many cold and flu medicines, sleep aids, and even combination painkillers. People accidentally double dose without realizing it. That's why experts say always check labels carefully and never mix multiple medicines without knowing their ingredients. Next up, let's talk about statins, the cholesterol-lowering drugs that millions of people take every day. Medications like atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, are incredibly effective at reducing bad cholesterol and preventing heart disease. But since they work directly on the liver to block cholesterol production, it's no surprise that statins can sometimes cause liver stress. Now, it's important to note, the benefits of statins often outweigh the risks. But if you're taking them, you should avoid mixing them with heavy alcohol use and always follow up with your doctor for regular blood work. The third category is NSAIDs, or non-steroidal anti-inflammatory drugs. This includes household names like ibuprofen, naproxen, and even aspirin. Most people use them for pain, inflammation, and fever relief. But here's what many don't realize. While NSAIDs are usually safe in small doses, chronic or high-dose use can harm the liver. In fact, ibuprofen and naproxen have both been linked to liver toxicity in rare but serious cases. The risk is much higher if you already have liver disease or if you're combining these drugs with alcohol. The problem with NSAIDs is also that they're so widely available over the counter. So if you're someone who takes ibuprofen like candy for headaches or joint pain, it may be time to think twice. Yes, the very drugs that save lives can also cause liver damage, particularly a type of liver injury called drug-induced hepatitis. One of the biggest culprits is amoxicillin clavulanate, commonly known as Augmentin. This is one of the most widely prescribed antibiotics in the world, but it's also the leading cause of antibiotic-related liver injury. Symptoms may not show up right away. It can take weeks after finishing the course for signs of liver damage like fatigue, nausea, jaundice, or dark urine to appear. The key takeaway? Never pressure your doctor for antibiotics unless they're truly necessary. And if you're prescribed them, always finish the course and report any unusual symptoms immediately. Finally, let's talk about a group of drugs that millions of people use for sleep, stress, and anxiety. Benzodiazepines like Xanax, Valium, Ativan, and certain sleep aids. While they're generally considered safe under medical supervision, these drugs are processed by the liver, and long-term or high-dose use can overload the liver's detox system. In fact, mixing them with alcohol or other medications greatly increases the risk of liver injury. This combination quietly increases the risk of both liver damage and dangerous drug interactions. Remember, your liver is a silent worker. It doesn't complain until the damage is already serious. That's why it's so important to use medications wisely, follow dosages, and get regular checkups if you're on long-term prescriptions. If you found this video helpful, make sure to hit the like button, share it with friends who might be unknowingly at risk, and subscribe for more health insights. Your liver protects you every single day, so give it the care it deserves.